much for being with us at this time. I mean, you have done this before. You volunteered after 9/11. You volunteered after Hurricane Sandy. Why did you decide to join once again?
I volunteered because I have worked 9/11. I was there the day in the emergency room, and I went to Haiti afterwards because I felt the need that the staffing and the nursing, we all needed to be there. For this particular, I don't know how you can say an event or a crisis, I definitely knew that New York was going to be hit hard. When I started to hear in the beginning of March, I wanted to come back. I had been here for 20 years for working as a nurse, and then I'd left the state and moved to southern Utah with my husband, and I knew my crew, my buds, my nursing friends were all going to have a really rough time, so I felt the need to come.
I am sure that they appreciated that you wanted to come. Governor Cuomo had something to say about this week. Take a listen.
9/11 was so devastating, so tragic, and then in many ways, we lose so many more New Yorkers to this silent killer. There was no explosion, but it was a silent explosion that just ripples through society.
You have offered care in the wake of both of these crises. Tell us what you're seeing every day at the hospital.
Sadness. You know, there's one thing to be said when you go to a real emergency room and you're sick. So much of the time you are dealing with the families as well, not only just the patient, and you're giving acute care, but the families are there. And what saddens me more than anything is that these patients that are dying or passing on, there's no family there for them. And I think that I'm a little emotional because I've been nursing for over 30 years, and it's probably the first time I've ever seen that we haven't been able to comfort the patient as much as we can because there's just no time. There's so many more patients. It's sad. It's really sad.
Yep. Yeah, no, I mean, I cannot imagine, and we are relying on those of you who are offering the care to give us a window into what that looks like. So I thank you for sharing that with us. Can you give us a sense of what morale is like in the hospital, given that this is what nurses and doctors are facing?
You know what? There's one thing I think with any large group, whether it be military, whether it be the fire department during 9/11, whether it be us now with nurses and doctors, and everybody it's the most incredible group of people you can be around. They're so motivated. Our job is just to get there and do the job. You know, we don't think about eating. We take care of the patients, and all of a sudden, if we have a minute break, we go and have something to eat. But we're there for the long haul, and nurses they're my buds. They've been my life for a long time as a career, but I wouldn't want to stand with anybody else but the people that I work with. They're strong. They're really strong.
There are a lot of people like you who want to volunteer, who want to be a part of this effort. The New York Times reported that as of Wednesday, there were over 90,000 medical care workers who volunteered to help New York, but the process was a little slow in order to vet all of these folks. Can you give us a sense of what the process was like for you?
So I'm a flight nurse and an emergency room nurse for a long time. And so when I started to apply, there's a lot of onboarding things that you have to go through, your physicals and your certifications and your license, and it takes time. I do think in a situation like this, and it's just a suggestion, there could be a countrywide system of where we're all in the system and that we can be quickly deployed, or in terms of nursing ability to get somewhere much quicker. It is a delay. There is a couple of weeks worth of processing. And I think in a crisis like what happened in New York and what's happening all around the country, it needs to be quicker. 100% it needs to be quicker. I have so many of my friends saying, can you help me get here quicker? Which agency did you go through? Which hospital? How did you do it? And every day. And for the last couple of weeks that I've been here, and it's a process. I get it, but it should be a lot easier.
Well, Lynne, we are all grateful for you, for your willingness to help, for your service. Thank you so much for taking the time to talk with us.